My name is Dan Mountcastle. I'm an MD. I graduated from Ohio State University. I'm board certified, and I specialize in the practice of phlebology. I take care of veins of the legs. Thanks for coming to hear our little lecture about veins. When I'm done, you'll know more than 90% of the doctors in the Tampa Bay area about veins. Veins are really one of the simplest things to understand in medicine. All of vein problems come down to problems of valves and pipes, the veins, and gravity. First, I'll review the anatomy of the vein system. There are 5 systems of veins that drain the surface of your legs. The greater saphenous from the groin down to the ankle, small saphenous from around the ankle up the back of the calf, the vein of Giacomini up the back of the thigh, and the anterior and posterior accessory veins. Everyone has these 5 systems, and they're shaped like an upside down tree. Imagine a trunk, branches, and twigs. An upside down tree. And all the vein problems that we deal with are associated with failed valves in these upside down trees. There are also about 100 perforator veins, little shortcuts about 1 inch long from the surface to the deep systems of the leg. They also have valves. And there's the deep system of the leg that drains the muscles and the bones. That's where you can get clots that go to your lungs. There are also valves in these veins. They hold up the weight of the blood. It's the heart muscle that pumps the blood out to the extremities, but it's the muscles of the legs that pump the blood back to the heart, and they can do this through this ratchet mechanism, these valves. When your leg muscles contract, when you move your foot or roll over in bed, these superficial systems, these trees, are squeezed and the blood goes rushing up, and the valves keep it from falling back. When the valves have broken, then everything below is carrying the weight of a column of blood up to your heart. Valves seem to fail from the periphery, from the tiny twigs upwards, through the branches and into this trunk. But when the truncal valves have failed, everything below is under pressure, and so the branches of that tree become varicose veins. One thing most people don't realize is that most varicose veins are inside people's legs. 90% are inside the leg. In fact, you don't have to have any varicose veins on the surface of the leg to have terrible varicose veins inside. These cause aching and tiredness, legs that feel older than they should. In the surface, they're ugly, and you can get phlebitis, which greatly increases your chance of getting deep vein clots, pulmonary emboli that can go to your lungs. So varicose veins are more than ugly and more than uncomfortable, but they're dangerous as well. The twigs of that upside down tree, the little capillaries, are thin-walled vessels. Now imagine they're holding up the weight of a column of blood all the way to your heart. They're only built to hold up the next 2 inches to the next valve. So they leak. They leak fluid and blood cells and protein, and this is what leads to some of the other symptoms associated with vein problems, with vein valve failure. The swelling of the ankles, terrible night cramps, charley horses that some people experience, the sickened, burning, itching skin, reddened skin, varieties of eczema, and even ulcers of the skin. On the surface, these become spider veins, the little red veins, and reticular veins, blue, purple veins on people's thighs or around their feet. There's a physical sign associated with that. It's called corona phlebectasia. You may have it. They're dilated purple veins along the instep and over the ankle and over the surface of the dorsum of the foot. If you see that in the grocery store line, you can say, oh, you have corona phlebectasia, a pretty sure sign of failed valves in the greater saphenous. So, that's the anatomy of the vein system. That's the pathophysiology. Failed valves lead to venous hypertension or increased pressure below. The branches dilate and become varicose veins inside the leg or on the surface, and the capillaries stay dilated, leak fluid and blood and protein, and become red spider and purple reticular veins on the surface. Now, the investigation of vein problems has come a long ways in just the last decade. The ultrasound now is so fine that you can see individual blood cells often. Waves of blood cells like clouds going past the valves. And the ultrasound is very definite. There's no gray zone, no doctor holding it up to the light and saying, well, in my opinion, this is probably this or that. There's no probably about it. You're pregnant or you aren't. Blood's flowing down against broken valves or it isn't. And right after the ultrasound, we can tell you what's going on inside your leg. The treatments for veins have changed dramatically. Everything, in fact, before about 7 years ago, before 2001, is outdated. We no longer do vein stripping. You no longer need a scalpel to remove surface varicose veins. We no longer do saline injections. All of those things are old-fashioned. The new treatments are elegant. To be elegant in medicine, a procedure has to almost always work, not have any complications, not have any downtime associated with it, and not hurt. All the procedures are elegant. Instead of the old vein stripping, which still frightens people away from having anything done with their veins, we do an endovenous laser ablation. Some people use radio frequency. We found that the laser is superior. That involves simply starting an IV in the vein through a little numb spot, sliding an IV catheter into the vein. Through the IV catheter, a laser fiber is introduced and located accurately with the ultrasound. You can't feel that. And with about 4 more small numb spots, the vein is surrounded with fluid. The laser fiber is pulled back over 2 or 3 minutes, and a band-aid is placed on the leg. Now that is what replaces the old vein stripping. It always works. It doesn't hurt. We've seen no complications other than soreness that builds up over about a week and goes way over the 2nd week, and some bruising that's also gone in 2 weeks. People can go back to work that day if they'd like. It's a perfect procedure, and there's really no excuse for anyone to have continued deterioration of their legs because of failed valves in a truncal vein, one of these 5 systems that drain the surface of your leg. Varicose veins are dealt with a bit differently. Until recently, and in fact even recently, even now in many places, veins were cut out of the leg. We don't even have a scalpel in our office, and we take care of veins that you can't imagine. We do a micro-phlebectomy. If a person's under 40, their veins have so much fiber in them that if you take the pressure off from above, they simply go flat, much like a new toy balloon. After 55, we're more like balloons that have been blown up overnight. You let the air out, it really shrinks, but there's still a balloon shape. So we do a micro-phlebectomy, which is also painless, always works, doesn't lay anyone up, doesn't hurt. We just numb the skin over the vein, and with a tiny needle, about a 16 gauge needle, make holes about every ½ inch over the vein. With a tiny instrument, reach through that hole and remove the vein. These varicose veins are rather small, really, and they're just near the surface. And it's very easy to remove them, and after some weeks, sometimes months, all those little pinholes are gone, and there's no scar and no varicose vein. It's really a very simple procedure. Thank you very much. If you think you have vein problems, you should call us and arrange an ultrasound.